Hello, everyone, and welcome to Conversations in Health and Care Improvement, the podcast dedicated to transforming health and care through quality improvement. I'm Pedro Delgado, Vice President at the Institute for Healthcare Improvement. And together with my colleague Amar, we explore the latest quality improvement agenda, sharing insights, real world experiences, and innovative strategies that can help enhance patient care and drive meaningful change within our health and care systems. Amar, why don't you go ahead and introduce yourself and introduce the amazing guests that we have today?
Thanks very much, Pedro, and really looking forward to this episode. I'm delighted that we're going to be focusing today on the topic of improvement methods and management systems. It's a topic that I know many people around the world are sort of grappling with, trying to make sense of, and we've got two fantastic guests joining us today who are going to help us with this. So let me introduce our guests and then invite them to say a little bit about themselves. So first, let me introduce Wendy Korthuis-Smith, who's the Executive Director at the Virginia Mason Institute. Wendy, you've got a long history of working at Virginia Mason in the US, and then now through the Institute supporting health systems all around the world with adopting improvements. So a very warm welcome to you, and say a little bit about yourself to our guests.
Okay. Thank you, Amar. So delighted to be here, first of all, with all of you. And as Amar said, I'm the Executive Director at Virginia Mason Institute. So our vision is to help transform healthcare across the globe. And we partner with others to really leverage the lessons learned that we've learned during our 20-year plus journey. And there's lots of lessons that we've learned that we hope others don't have to go through some of those same processes. Personally, I've been in the field for over 30 years, helping drive large-scale transformation and change. I started my journey on improvement in prevention and cardiac rehab, and I transitioned that through a job switch from Boeing to Virginia Mason, where I currently am at, back in the 90s. And I thought I made this innovative change around improvement. And I really just simply went from individual improvement for people who were having heart disease or diabetes to improvement for organizations and teams and leaders. And so it wasn't such a novel shift that I thought, but that is where I am today, and have a doctorate in educational leadership with an emphasis in organizational development. And so as I respond to some of the questions, you might hear a little bit of my OD mentality sneak out periodically around my philosophies and the work that we do. And the last thing I just guess I would say is why I'm so interested in this work is because it impacts all of us. And I think about every moment, if I go into my setting or a client setting, there's people in the hallways who are going through this really difficult sometimes experience. And it's probably where I feel my most vulnerable when I'm a patient. And I think others feel most vulnerable when they're a patient. And we're literally putting our lives and our loved ones' lives in the hands of others. And so it's that part where how can we make it better for people as they're going on that journey and really have the best experience as possible so that we can make that meaningful, lasting change. So I'll end there.
Fantastic. Thanks, Wendy. And we're delighted to have alongside you today Jafet Arrieta, who's Senior Leader and Vice President at the Institute for Healthcare Improvement. Jafet, a very warm welcome.
Thank you so much, Amar and Pedro, for the kind invitation to join this conversation in health and care. Hi, everyone. My name is Jafet Arrieta. I'm a vice president with the Institute for Healthcare Improvement. And in my role, I have the privilege of leading our measurement, evaluation, learning, and dissemination work, as well as our work in the Latin America region. I am deeply passionate about improvement science, and at IHI, we work under the mission that we want to improve health and healthcare worldwide, and the vision that we do that for all. So putting equity at the center, because when we cannot talk about quality without talking about equity, and we work to make sure that our methods, our systems, our processes, and the work that we do in partnership with many organizations around the world and individuals and people with lived experience and communities really creates better outcomes and a better experience for all, regardless of where they are born and the conditions that they live in. And so I am a physician by training. I have a master's in medical sciences in global health delivery, and I also have a doctorate in public health. So I love working at that intersection of improvement science and health system strengthening, because as one of my mentors, Dr. Julio Frank, will say, it's when you work at the systems and population level, the population becomes your patient. I still miss seeing patients one on one, and I live vicariously that experience through my husband and partner, who still gets to see patients from time to time. And then I also try to, as I work to with IHI and our teams around the globe, to strengthen systems, always with the vision of improving outcomes and creating impact and creating value for individuals, for communities, and for systems. Again, I always try to think about, or go back to thinking about designing and doing work that will benefit my family members or myself, because I think that when you design with that in mind, you aim always for the best. So thank you again for inviting me to be a part of this conversation.
Pedro, I'm going to invite you to sort of kick us off for the conversation, but I think it's going to be a fantastic discussion. And actually, we've deliberately brought together Virginia Mason Institute and the IHI, partly because you both work with different methods. And it'll be really interesting to tease out the differences and similarities across what might be perceived as very different approaches through the conversation. But Pedro, let me hand to you to kick us off for the conversation.
Yeah, definitely, and it's a very welcome conversation. Actually, there is a visual in my head always when we think about improvement science, which is it's an umbrella term, and underneath that there's a lot of different ways of bringing about improvement science, but the elements seem to be very similar around respecting the human being and putting the human being first, the people we serve and the people that do the work, about understanding processes at the core and then working from there to try to improve them in order to get best possible outcomes, and to do that in a way that is sustainable. But you both hinted at two things. One is leadership, and the other one is systems. And one of those concepts that we have tattooed in our hearts, I think, at the IHI at least, and most of the improvement community, is this essence that every system is designed to get the results that it gets, which offers an ongoing, eternal opportunity to improve how we design systems. But Wendy, can you describe briefly how you see the interconnection and interdependencies of systems and leadership?
Yeah, no, that's a great question, Pedro. Thank you for that. When you ask the question about like, what do I see? I have different lenses of things that I see. So one is my own site back in the Pacific Northwest of the US, right, which has been on this journey for quite some time, somewhat of a mature organization. And I see something there. And then we could go out and do, on the other end, when we go out and do readiness diagnostics with potential clients and talk to them about, tell me about your methodology, and, that aligns with the leadership and the systems perspective, I get very different answers, right? And so thinking about kind of the basics of this in terms of improvement methods, and I love the fact that you draw on the word system, because I see for me and my prime organization, and then what we aspire to help clients with, it's all about a systems approach. And so thinking about how can you take this, as you described, an umbrella, and all of those things that are underneath it that are so similar and so beneficial for us to use and leverage, and kind of break down some of the reductionism around improvement and think about blending methods and having hybrids together. That systems perspective comes front and center. And so two of the things that I think are most important in this, and you just hit them directly there, Pedro, was having leadership committed to this work, and really having that leader walking the talk, believing in the improvement work, believing in the ability to move this work forward as a priority, personally involved, going, seeing, asking why, showing respect as they go through their organization. And really that it starts at that point, because without the leaders, and I've seen this in many instances, it's just not sustainable. And so you could have pockets of improvement or points improvements going on in an organization and people working really hard trying to make things different. But without that leadership connection, leaders really lighting the path and showing the way and role modeling that on a day-to-day basis, it really does not have the sustainability that it needs. And then the system piece tied to that, for me, I think about within an organization, we consider kind of three elements of a systems lens. There's the strategic alignment, which is really cascading across an organization or a clinic, for example, whatever the entity is, top down, bottom up, and making sure you have that golden thread about what's most important. And again, that ties nicely with leadership sharing that true north or that direction. And then how do you make sure that's happening across a system, so cross-functional? And so our patients don't see silos of excellence in many instances. They see a pathway, a value stream. And so how do we make sure we're looking at the improvement through that lens? And then the last piece from a systems perspective, I would say kind of that daily management, what's happening in all of those places across the organization. And I think of these lights coming up where improvement's happening across and getting that multitude of opportunity for people to experience and share and learn and grow. So not sure that answered directly, but you can come back at me if I missed something there.
No, it was intentionally a broad question, Wendy, and it's a great answer. And Jafet, I wonder what's resonating with you in terms of what Wendy's sharing and anything else that you want to offer around the question of systems and leadership.
So everything Wendy shared resonated, and I hope I'm not just duplicating and echoing what you're saying, Wendy, and I hope to build on that. So, Pedro, I think those two elements, systems and leadership, need to go hand in hand when we aim to improve health and healthcare worldwide. Because we are, at the end of the day, we are social beings. So we are all a part of a system in one way or the other, and actually multiple systems, right? And I like to think about, and credit to our colleague Sidney Klashner, who has been talking about the importance of thinking about the ecosystems, because I think that more and more, right, we've been focusing and the science of improvement, implementation science, and all of the other methods that we borrow from have continued to evolve. And I think that the only constant, or one of the main constants, has been the importance of working on systems if we are to create lasting change at scale, sustainable change. And I think oftentimes we become, as Wendy said, too reductionistic, right? And think about, okay, it's important to get people to do the thing, but in order for people to do the thing, to adopt evidence-based interventions, we really, really need to look at the enabling environment, at the system, at the conditions that ultimately create the outcomes that we're trying to improve and change. Because going back to what you were saying when you were quoting Batalden, every system is perfectly designed to get the results it gets. So we really need to look back at the system and understand, and I go back to one of the core components that we use at IHI. It's one of our frameworks and one of the methods that we use, right? And we start by understanding the system, understanding the different elements of the system, how they interact to create those results, again, that we are trying to change, so that we can think about more systemically and systematically, right? What are the elements that we need to redesign, change, where there is room for efficiencies, where the main bottlenecks are, and also so that we can look at the enabling environment more broadly. Because I think one thing that I would like to be very, very explicit about is the need to think about systems beyond the walls of the hospital systems that we work in, and think about systems more broadly and look at that ecosystem and think about the cultural piece, the context, the social piece that ultimately condition the outcomes that we see and try to change. And so that takes me to the second piece around leadership. If we are to redesign systems, to change systems, to create and sustain better outcomes at scale for all, we need to work hand in hand with leaders. And Wendy, you use this analogy that I love, right? Sometimes we are forced to think about whether we approach something bottom up or top down. In my mind, it's not one or the other, it's both and. Because ultimately, we are people working with and for people. And I actually think that leadership is not a title. Leadership is not a title. We all have the capacity to be leaders. And Amar asked me to bring life to this work and bring examples. So I'm going to briefly talk about the golden hour work that we are doing at a large scale with our partners at St. Jude Children's Research Hospital, aimed at reducing the time to antibiotic administration in children with cancer who present to the emergency department with fever and who are at a greater risk of developing infections, sepsis complications, and ultimately die. And so I'm going to highlight the role of leadership at multiple levels. So when we first started working on this project, there was a lot of evidence around the golden hour, those 60 minutes, right? We all know about that, and it applies for many other patient populations. And so we started by understanding the system and the problem within the hospitals that we were working with, and looking at the multiple elements across the continuum, starting from when parents suspect fever at home and the barriers that condition them showing up to the ED hours later, right? They've already missed that 60-minute window. And so that's important. That was important for us to think about, because then we think about leaders and we think about the parents and the families and the communities and the role that they play in also being a part of the co-design and co-production processes to improve those outcomes. And then if you map out that continuum of care, right, or that patient journey from their home, you identify many other points where you can intervene even before they get to the doors of the hospital. But so going back to leadership, and I'm gonna end here, right? One of the things that we realized is that in many settings in public hospitals, right, the first person that comes into contact with patients who present to the emergency department are the custodians. So think about the value of thinking beyond when you look at systems, and instead of just focusing on the healthcare providers, really, really engaging with all of those people that have a role in changing and improving outcomes for all. So we had started engaging the custodians, all of the people in the emergency department, of course, right, in this process, highlighting, using that leadership lens, right, the behaviors that have the potential of improving outcomes for patients, for families, and communities. And so with that example, just going back to the analogy of the top down and bottom up, we started this work bottom up, right? And now we have been able to, in Mexico, based on the work that we are doing at large scale, really influence policy and decision making. So I do believe in the role of leadership, creating, redesigning systems and creating lasting change. And it can be both top down through policy making and decision making, but also bottom up, because at the end of the day, I think we are all leaders in one way or the other.
Thank you both. And what was really fascinating for me was how both of you in your descriptions really frame this in terms of what Deming would describe as profound knowledge. You're really helping ground this in the fundamentals of improvement, which are about systems thinking around behavior, around variation in outcomes, and people's theories about how to make things better. I wonder whether you might both be able to help us. Well, take us back to some of the sort of very early questions that people might be asking as they start thinking about improvement and thinking about how to introduce it into their own practice in their own organization. One of the first things people often have to grapple with is, the choice of method. People feel like there are different choices here. They're sometimes not sure how to choose a method or how important a method is. And I wonder whether both of you could give us some perspectives on that, given both of your extensive work with different organizations with particular methods. What do you think about how important method is in this work? Wendy, do you want to give us some thoughts first?
Sure. So great questions again. When I think about method, I think about, well, it depends on who's describing or defining the method in part, because I think some people think, and Jafet, I appreciate your comment about reductionism, because I think sometimes we like to reduce things down to its smallest parts when it comes to methods. And so sometimes people, I think, feel boxed in about a particular method, and oh, well, that's not a tool of this method, and so I must stay pure to this methodology. I think, as I mentioned, when we go out and talk to people about what methods are you using, you hear everything from, a scattering of this, a scattering of that sometimes, on a continuum. Well, there's nothing. Then there's a scattering of things. And, one department's doing something around this, maybe at that micro level. And I've actually also heard, within an organization where they have 9 methods running at the same time, which is quite interesting in itself, right? And so I think, to your question about how important is a method, I personally feel like a method is so important. I feel like the benefits that you get from having a method are just, the alignment that you can create from that, the shared understanding, having a sense of a shared framework, common tools, ability to share and spread. There's just so much momentum that can be gleaned from having a method. But then I think you have to go back to, well, what method are you thinking about picking? And, always like people to start where you're at. And so, again, going out and doing a diagnostic and seeing, like, what are people comfortable with? What's working in your organization? What works for your culture? And not to be feeling like, oh, you have to switch. You have to completely switch the method you're doing today. But how can you blend things together? I know maybe we'll talk about hybrid methods at some point in this conversation as well. But there's such richness, I think, with having the opportunity to really try to understand what's available to you and how does that meet and align with your culture and what you're trying to achieve. And so having kind of that structured approach with the method, I think, is so important. And kind of the basics, I would say, at the small m method would be, problem solving, right? Or finding opportunities and looking at data and analysis and root cause, and trying to address the root issues versus the symptoms, and then trying to implement and monitor and evaluate as kind of a basics of some of the different kinds of methods. And then I have to say, of course, the method that I'm most comfortable with is our Virginia Mason production system, which is our improvement method. And that was based on, I think several of you know, but Lean and the Toyota production system. And one of the reasons we gravitated towards that method was because it was something that everyone can do. And Jafet, I loved your comment about, like, the custodian. You walk into a hospital and you see, and couldn't that person be doing improvement in their day-to-day as part of their day-to-day, thinking of ways to improve as you were describing. And so thinking about a method that allows, or maybe it's a bit of that equity, something that's not overly complicated and allows everyone to have the opportunity to kind of play in that space around improvement that they do. And so thinking about the methodology that I'm most familiar with the Toyota, and we took it from Toyota graciously and added a heart and applied it to healthcare. And really tried to think of, okay, what works with this and what doesn't work with this? Because again, we're a healthcare system for that. And so I think for us, the very foundation pieces of our work are around the tools and the principles and some methods, plural, because you could think of an RPIW could be a method, of tackling a situation. And so again, I think of like the little m and the big M around method. And then thinking about a bit of what Pedro was asking about how you layer that with leadership and that systems perspective that cuts across the organization and really helps spread and share that. And then, Amar, you mentioned something too around like that deep respect for people that has to come with this and the evolution of the improvement. And so mixing those together, looking at, we see them as two pillars basically, with the flows of medicine or the flows of health and care in the midst of that. And so You asked several questions. I'm hoping I'm addressing a few of your questions in terms of, yes, absolutely believe a method is important to have, declare one, start with one. Doesn't necessarily matter as much, I think, about which one it is, as long as you get started with something and that you have that commitment, that leadership piece to it as well. And then, reaping the benefits of that unified approach, the common language, the shared understanding.
Well, that's great advice and really, really nicely laid out, Wendy. I know in our conversations over the years, I've been struck by actually how little weight you put on the language of method in the way you describe this. And it's much more a way of leading and a way of managing. And that framing seems much more important in certainly in the way I've heard you describe the improvement way that you support organisations with. I wonder, Jafet, what your reflections are.
I fully agree. Methods are key. And I think this is not just about healthcare, right? Like historically, we have used the scientific method and we have adapted it. So I think my understanding of method, and I'm just going to frame it in the context of improvement science, is a systematic, iterative approach to improving processes, to improving systems, to redesign systems, to improving outcomes, and to producing value. And I think methods are key because ultimately, if we do not have a systematic way of doing things, it's hard to replicate them and to do that at scale and to sustain the improvement. So I think designing with a method in mind, but designing for scale and sustainability is key. And so going back to what Wendy was saying in terms of what method, I cannot tell you how often I get this question. So should I use improvement science or implementation science? And if I use improvement science, should I use Lean, Six Sigma, or the model for improvement? And I always go back to, okay, first, could you first tell me what is it that you're trying to accomplish, right? Because ultimately, form and method in my mind should always follow function. So going back to the notion of leadership, as long as you have constancy of purpose and clarity on what your North Star is, at IHI, our North Star is the quintuple aim, right? The quintuple aim, which aims at improving the experience of care, improving population health, improving, creating value for systems, creating efficiency, increasing productivity that can resonate with some leaders across some health systems, but also making sure that we're keeping our internal users in mind, improving the joint work and the experience and the well-being of the healthcare workforce. So that is key, and doing that with equity, right? So once you have that, which that's our North Star at IHI, and that might be different for different health systems, right? Then think about what is that you're trying to accomplish more specifically, right? And if it is, reducing pressure ulcers, then go back from there and think about the method or the methods. I think, and I'm going to quote my colleague Trisha Bolender, she always says that every framework is wrong and some are helpful. So when people again ask me which method should I use, I always say use what works. And I love what you said, Wendy, about the ability to integrate and take from different methods what works for you and adapt. And that takes or requires a deep understanding of the system, a deep understanding of the problem, and a deep understanding of the context. So, building on methods, at IHI, the method that we've chosen to use is the model for improvement. And I like to refer to the model for improvement as revolutionary common sense. Because basically, if we look at the three questions, I think my 4-year-old does that every day. So question number one, what are we trying to accomplish? The question that, again, I ask people when they ask me which method should I use, right? The question that I ask my kid when he asks, Mommy, how should I do this? Okay, what are you trying to do, kid? So what are you trying to accomplish? And then how will you know that what you're doing is leading to improvement, so measures? And then question number three, what will you do? What changes will you make that will result in improvement, right? But that, again, needs to tie back to the understanding of the system, the context, the problem, and your aim. And then at IHI, again, we use the Plan, Do, Study, Act cycles at the engine of change and learning. And then the second element, in terms of methods that we use at IHI, and happy to share some examples, right, align with the 3 Ps, right? Quality, the core components of design. So building on the model for improvement at IHI, we've been asking ourselves, okay, how can we provide guidance and accompaniment to our partners as we learn together and improve together, right? To approach big challenges and issues in a systematic way to lead to better outcomes and sustainability and scale. And so we do that by, again, expanding on the model for improvement and using these 6 core components that I'm going to summarize in a minute. So number 1, going back to the system of profound knowledge, to Deming, is understanding the system, diagnosing the problem, understanding the factors, the multiple factors, because the problems we work on are multifactorial. So the multiple factors that contribute to those problems within the walls of the health systems and outside the walls of the health systems. And then the second element is, based on that understanding, what is your aim? What is it that you're trying to accomplish? And be specific, right? Set smart T aims. That's often what we advise to leaders and improvers around the world. And then once you have clarity on that aim, so what's your theory, right? How are you going to go about improving? And it's not just about the thing that you're trying to improve, the evidence-based intervention, but it's also about how are you going to create the conditions to enable people to close that no-do gap and do the thing in a reliable way. And then that's followed by having a strong measurement, evaluation, and learning plan, right? Learning is key. And I want to highlight the importance of going beyond measurement as we try to ask question number 2 of the model for improvement, because ultimately that creates that learning cycle and system and contributes again to better and sustainable outcomes. And then finally, one thing that is really important for us, and that's why I wanted to share the 6 core components, is having clarity on the execution theory. That the model for improvement doesn't make that very specific, but having clarity on what are the inputs, the outputs, the activities that you're gonna need to put in place to achieve better outcomes is important. And what's the model, what's the framework if you are, for instance, working with over 100 hospitals or across a larger health system or on a multi-country project, having clarity on the implementation design that you're going to use to systematically drive improvement. And then finally, what's going to be the communication and sharing mechanism or mechanisms that you're going to use both internally within the participating teams and institutions, and also externally, because I think we do have an obligation to disseminate both what works and what doesn't in real world settings so that others can benefit from that.
Amar, let me build on the responses from Wendy and Jafet. I'm really curious actually to hear both of you on this. In the UK, and Wendy, you're somewhere in England right now, as are Amar and I. There is a narrative around productivity. And obviously it's the 14th of January as we record this podcast. And it's probably one of the busiest winters we've ever seen across the NHS, which means people are working really hard to bring about amazing results for and with patients. So, there's a number of people that react with emotion around productivity. Does that mean I'm not productive? And we had Thea Stain from Newfield Trust here on the podcast and a conversation around that and so on. And there's no running away from the fact that people are held to account based on some of the activities that they generate on their practices and so on. But in terms of language, what have you seen work really well in your transformation efforts with organizations when things have really gone well, when things have really been sustained? What kind of language do people tend to use to frame the opportunity to improve that perhaps exists every day in health and healthcare?
So I have to say, when I think about productivity, I think of the essence of what is productivity, which to me is around maximizing value for the resources that we have. And so thinking about what that means, though, to people, and people have to find, the words and the language that are most meaningful to them. And I can see the notion of, well, what do you mean by this word? Is it suggesting I'm not productive? And so we need to work on productivity. The words that we've used in the past at the very simplistic level are around demand and capacity. And so I think in terms of all of our departments or divisions within an organization, there's an expectation that everyone understands demand and capacity. And so whether you're a clinic or you're in accounts payable or you're in human resources, like what is the demand for the day? And what's the capacity for the day? And we know that if our demand exceeds capacity, we're going to have to move things around. In some instances, we started moving things around in a very small sphere, which wasn't super helpful, because if you're doing okay here, but somebody else was really struggling. So then we had to open it up into more model lines and look at demand and capacity across broader areas and think about how are we doing in this space. Demand and capacity isn't a very attractive word either, I will say. But I think value is the one that really tends to stick in terms of, what is the value that we're providing today? What's the value we're providing tomorrow and the next day? And so when we talk with people about this work, we think about how important is it for leaders and managers to know their work, to manage their work, and to improve their work. And that happens throughout the day in areas. It could be, a huddle that's happening at 10 o'clock and we're looking at, the boards and we're looking at beds and what is our day going to look like? What did we learn from yesterday we're going to try and do something different, a little PDSA to see if we get better improvements in how things shift today. And so it's this ongoing aspect that's built into the daily work we do around adding value. And I tend to prefer that word more than productivity, candidly.
Thank you, Petra, and thank you, Wendy. I fully agree with you, and that's the word I was going to use. And credit to my friend and colleague Andrea Bernard. She always talks about the importance of shifting from talking about return on investment to talking about return on value. And value can mean different things to different people depending on where they sit in the system. So I think, and I go back to what I was saying earlier around constancy of purpose and your North Star. And I think once you're clear on what is it that you're trying to accomplish, then you can define what value means to you. And that can be productivity, Pedro, that can be efficiency, that can be increasing like throughput, volume of surgeries, that can be reducing length of stay, right? And so you find a way to, once you have clarity on, again, what value means to you and what you're trying to accomplish, you can find a better way to go back to the method and think about what is it that you're going to measure, how you're going to measure it, and how you're then going to work together as a system to create value. And that also, Pedro, you the way you framed the question, I loved it. I think you talked about the importance of language in framing, and I'm also going to quote Maureen Bisogniano. He always talks about the importance of being multilingual. And when she says that it's not about being able to speak multiple languages, or maybe it is, right? But she says, like, always speak the language that aligns with what matters to different people, right? So with what value means to them. So I guess, and going back to what Wendy was saying, thinking at the end of the day, how did I create value for patients, for families, for the system? And what am I going to do to continue to create value, incorporating what I learned from what I did today? So I'm just going to end this question, the answer to this question, by going back to the question about methods. Because at the end of the day, I think that language matters, methods matter, and rigor matters. Don Berwick always talks about honoring the rigor. So I think, yes, having clarity and having a method is important, but honoring the rigor and creating the culture in the institutions, in the systems, to make sure that those methods are constantly used, regardless of which methods each organization decides to use, and that they're used reliably, that they are integrated into the systems, into the culture, that they are used consistently with fidelity. I think that's what ultimately leads to creating value, Pedro, increasing productivity, if that's what value means to some people, right? And to doing that in a sustainable way. And the last thing in terms of sustainability that I think is key is, and this touches, Amar, on the question about management systems, is having a way to more regularly and systematically monitor those indicators that align with that concept of value, and socializing them and sharing that progress via huddles. Wendy mentioned that as an example, having dashboards, creating meetings to celebrate those short wins that ultimately lead to bigger wins and sustainability. I think it's about bringing those elements together: leadership, language, methods, and rigor, and keep them front and center, following, of course, that constancy of purpose.
Fabulous. Thanks, Jafet and Wendy. As we start approaching the end of this conversation, I wondered whether we could just pick up your nudge, Jafet, around language and thinking about how we untangle some of this for people. And you brought in the question of management systems into this, which is another M word here. And I wondered whether you could just help our listeners make sense of this, because in England, in the NHS Impact Framework launched a couple of years ago, one of the 5 pillars is to really try to make sure improvement is embedded within a management system, and that's caused some great excitement and also some confusion about what exactly a management system is. So I just wondered if you could give us a couple of thoughts on what is a management system. Is it the same as a method? Is it different? How do the two interact?
I like to think of the management system as the connective tissue. And I said at the beginning that I was a physician, so I'm going to make that analogy. In my mind, a management system is what enables systems to reliably use methods to consistently deliver better outcomes and to sustain them and scale them. And it's a mechanism that might include approaches, tools, data systems that allow people to collect, analyze, visualize, report on healthcare data and learnings over time, and to incorporate that learning systematically into the systems. And that also touches, in my mind, on operational efficiency. That's something that we are talking a lot about at IHI as we think about better ways to help optimize the resources within a system and integrate. And so data management systems and quality management systems, I think, are a critical foundation to guide decision making at the leadership level and to guide improvement and learning. And I'm actually going to share a provocation, Amar. I think we need to talk about management and learning systems, because I think that language matters. And sometimes management can have a connotation that is more tied, Pedro, to what you were saying before, productivity. Again, it depends on what value means to people and systems. But I think in my mind, the key is learning, right? Not just managing, but learning. And at IHI, we've been working over the past couple of years to redesign and think about better ways to promote continuous iterative learning in a more systematic way, Amar. So I know we're almost at time, so I'm going to pause there, but I think management systems are key, are essential, and we need to couple them with learning systems and think of those as not the thing, but the enabling mechanism to achieve and sustain improvement.
Thanks, Jafet. So, Wendy, in the last minute or so, what would you say about management systems?
Well, first, I have to say I love Jafet's comment about management and learning systems. I've often struggled with the word management systems, just to be a bit vulnerable, because, you think of manager versus leader. And I know we describe it, our own management system, we describe as a system to help leaders create focus and direction to drive sustainable, measurable results, right? So we try to couch it with those words, but when you think about management itself, it still feels somewhat controlling, and so the learning part, I think, is so important and so impactful. And so I loved your comment on that. I would also say, I guess, that, for us, it's about healthcare is so complexity. We all know that. So complex. And so having a management system provides that simplicity. It allows everybody kind of that structural assurance, knowing these are the way things are going to happen in our organization. There's an expectation that leaders are going to round on a daily basis. There's an expectation that units are going to huddle on a regular basis. There's a belief that everybody's looking at improvement as we continue, through this with a very respectful and challenging culture in terms of trying to continuously grow and move forward. And so having those pieces, I think, are so important. And coming back to, I love the interstitial example as well. It's like the pieces that hold everything together. Because it's really about how do we do what we do on a day-to-day basis, and having that management system gives us that freedom, gives us that direction, that alignment that allows us to really make the most of each and every effort that we make in that improvement front. So.
Yeah, and how difficult is it to try to summarize? But I'll take a stab at saying a few things. You've both highlighted the interconnected nature of systems and leadership. And beyond that, that leadership and systems are more about the practices and how we see that convey a sense of learning and continuous improvement rather than a theoretical kind of approach to it. How important language is, and how the language of value tends to resonate with leaders across many geographies, perhaps. And in this last point, how a learning ethos can supersede and can be the kind of foundation, really, of what a continuous improving system that gets to exceptional outcomes may be. But more than that, I saw a lot of love go back and forth. I love what Wendy said. I love what Jafet said. And I think that ethos of love, partnership, collaboration in the improvement community is going to be really important for all of us. No one has a single answer, no organization, no division, no service as a single answer. And I think the opportunities that we have in front of us with technology, with the wisdom that staff across the world are developing, is going to be unique, and I cannot wait for us to continue to share this, and maybe 10 years from now talk about what we did in 2025 and 2026 to navigate this opportunity and this tipping point that we were reaching. But from Amar and I, from conversations in health and care, and with an ethos of love for sure, and continuous learning and improvement, we want to invite you to join future episodes. We want to invite you to say thank you to Jafet and Wendy, wherever you are, wherever you listen to your podcast. And we want to invite you into conversations of exchange also wherever you are, locally and then across boundaries, because they matter. So thank you to our guests, and we'll see you soon.